Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, causes of sticky poop and when to seek care. Sticky poop is a common symptom that people describe to healthcare providers, and it can mean different things. It generally means stool, feces, that is abnormally greasy and hard to wipe away after a bowel movement. This is a common sign of steatorrhea, a condition associated with celiac disease, diet, liver disease, and other causes in which there is too much fat in your stool. /r/n/r/n sticky poop may also describe excess mucus in stool, a symptom that can occur with an intestinal infection or inflammatory bowel disease, IBD. On the other hand, stools that are sticky and tarry may be a sign of bleeding from a stomach ulcer or colon cancer. /r/n/r/n a gastroenterologist may be able to diagnose the cause with a stool sample, blood tests, diagnostic imaging, and if needed, a biopsy of tissues. /r/n/r/n/Withaya Prasongsin Getty Imagesrnrn Steatorrhea occurs when there is excess fat in your stool. The symptoms can vary depending on the underlying causes, but generally present with /r/n/r/n Steatorrhea often occurs when the secretion of bile, a digestive enzyme produced by the liver, is blocked. Bile is responsible for the brownish color of stool, and a lack of it can cause stools to turn pale. Bile also plays a role in fat absorption. /r/n/r/n Steatorrhea may also when the absorption of fat in the intestine is impaired or you consume excessive amounts of certain dietary and non-dietary fats. /r/n/r/n Many conditions can cause steatorrhea including /r/n/r/n Sometimes sticky stool has nothing to do with fat but instead describes a stool that contains a lot of mucus. /r/n/r/n Mucus is a substance consisting mostly of water and a gel-forming molecule called mucin. It is secreted into the intestine by glands, called submucosal glands, to lubricate stools and help them glide smoothly through the gastrointestinal, GI, tract. /r/n/r/n At normal levels, mucus is usually unseen on stool. However, if the GI tract becomes irritated or inflamed, it can start to produce excessive amounts of mucus, causing symptoms like /r/n/r/n There are many possible causes of excess mucus on stool, some of the most common of which include /r/n/r/n Melena is a term describing black or tarry stools caused by bleeding from the upper GI tract, including the esophagus, stomach, and large intestine. As blood leaks into the GI tract, it is exposed to oxygen which causes it to oxidize and turn dark. The blood will become stickier as it starts to coagulate, clot. /r/n/r/n In addition to tarry stools, melena can cause other symptoms depending on the underlying cause, such as /r/n/r/n There are many possible causes for melena, including /r/n/r/n While some cases of sticky poop may seem obvious, such as greasy stools after a large dose of mineral oil, other causes may be harder to diagnose and require investigation by a gastroenterologist. /r/n/r/n There are many tests a gastroenterologist may use to pinpoint the cause of sticky poop, including /r/n/r/n An occasional sticky poop isn't usually something to worry about. However, if you consistently have sticky poops, it's best to see your healthcare provider. /r/n/r/n Tarry stools, on the other hand, are of concern and should be seen immediately because they suggest bleeding somewhere in the GI tract. /r/n/r/n While some black stools have nothing to do with bleeding, those accompanied by the following may be signs of severe bleeding that can lead to shock. /r/n/r/n Call 911 or rush to your nearest emergency room if symptoms like these develop. Delayed treatment of shock can lead to multi-organ failure and death. /r/n/r/n sticky poops can be caused by excessive fat in your stool, steatorrhea, due to diet, bile duct obstruction, and malabsorption disorders like celiac disease. Excess mucus in stool may be caused by food sensitivities, intestinal infections, IBS, IBD, and cystic fibrosis. Stools that are tarry due to bleeding, melena, may be due to a peptic ulcer or colon cancer. /r/n/r/n The cause of sticky poop may require an investigation by a gastroenterologist, including stool tests, blood tests, imaging studies, endoscopy, and biopsy. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.